the lack of awareness being the greatest enemy of hearing loss. And in a parent's point of view, there is a lot that goes on that is not captured even in the cost of rehabilitation. Parents put in a lot of time, put in a lot of resource, they live up so much, and that is not captured, is not costed, is not quantified. Now, we also know that the burden of unaddressed hearing loss is borne by communities, much more. Families with which is a best unit of community. I know a lot was said at the conference, but it's also good to repeat some of that which was said in the conference for emphasis. Parents are working throughout 24/7 without rest and without an allowance, for that matter, to change shifts and all that. But we are only coming here exhausted, being bombarded with a lot of information that we don't know. You hear of sensory neural hearing loss. You don't, all these new terms that the parents get on diagnosis. You don't have a lot of time to synthesize all of this. And in order to circumvent such social stigma that is associated with hearing loss, I do believe that parents need emotional support. Parents need the apt social support through parents groups, through education, and also parents need to be supported to become professionals in the ear and hearing care services, so that the hours they are putting in rehabilitating their children, these can be allotted a bit of CEUs for the time they are in, so that at some point, that is a motivation that, yes, I stayed home for 2 years and my child is better and I have something added to my knowledge. Next. Okay, yeah, so why parents? I do believe that parents have the stories which make up the genesis of advocacy, which make up the data. So by putting all this in consideration, it's worth hoping for the best way to harness the future of their children. Now, without targets, without budgets, without plans, the only motivation parents have is to see their child, is to see their son, is to see their daughter become better and live a mainstream life. We are not motivated by the numbers, 100 numbers, thousands of numbers. We are motivated by one child who has been transformed. And that child is your daughter, that child is my daughter, my son. That is the motivation. We put in all that we do to make sure that these results are actually tangible. And again, this brings us to one point, that all the data, all the science going on, it comes back to affect the life of an individual, whether it is a successful implant, whether it's not a successful implant, that is a life of an individual. So I do believe that parents, once again, are the real deal in advocating for cochlear implants at community level as well. Next slide, please. Yeah, so going through the challenges, I've already alluded to a lot, some of these, but I do believe that more than 90% of the children who are born with hearing loss are born to parents with hearing. So by the time your child is diagnosed with hearing loss, you actually don't have any information. Sometimes you even don't have anybody in your family who has hearing loss, because the world has changed. Then it also comes with the fact that in developing countries, like Professor Carolina has said, the financial strain in low-income countries is quite huge, where countries where governments don't sponsor cochlear implants. It comes back to the family. So we see family putting all they have, putting all their resources into one single implant, into one single ear. They sell land, they sell houses, they leave jobs, but to just make sure. So this is quite a challenge. And navigating through the healthcare system to get the timeless services. The healthcare systems where you also find that even the healthcare professionals are unaware of what a cochlear implant can do, or are unaware of what is available for rehabilitation. Family relations also are strained, husband and wife, siblings. There is sibling rivalry. There is one time when my daughter asked me, my daughter who is following the one with the cochlear implant, and she said, I wish I had a cochlear implant. I asked her why. He said, because you give more attention to Elaine because she has a cochlear implant. I was like, okay, this is reality. So family strains are there. The time that you have, balancing responsibilities for successful intentions depends upon the family support. But what are we, therefore, what are the opportunities available for us? We see that if there is early intervention and newborn screening, that can help mitigate the impediment of rehabilitation. We will have better services. Empowerment for advocating. We have learned a lot about this advocacy now, but we need to keep the momentum. And how do we get to community support? If all the biggest percentage of the unaddressed hearing loss is being borne by the family, by the community, how do we help that? How do we change that into an opportunity to advance technology in order for it to be available and accessible and affordable at the same time? In other words, education and innovation at community level, including where we don't have, for example, speech and language pathologists. How can parents and families come in to do the job that a speech therapist would have done, but this family is having this child all the 24/7. So by educating and empowering them will help. Next slide, please. All right, so what is our story at Hear His Voice Uganda? I have said this before, but out of, let me say, out of frustration, there needed somebody to put his back or her back to change the way things were being done in our country. My wife and I, having gone through our own challenges of raising up a child with a cochlear implant, we started Hear His Voice Uganda. And over the years, we have seen and have endured the cost. We have paid the cost of trying to pave a way for better services in our country. We walked on the streets of Kampala, making noise, knocked on people's doors, and we were able to see that taxes were waived on hearing aids and cochlear implants and all hearing aid accessible parts, which was great. We have also sourced partnerships. I think it was Carolina who talked about strategic partnerships. We would like to see that, yes, parents don't have the money, don't have the expertise in cochlear implants, but we can make strategic engagements, and we have the voice if we have the direction to go. And through these partnerships, we partnered with university. All these pictures we see in the top left corner, that is a surgery taking place in a refurbished cochlear implant theater at the university. The top right corner is a temporal bone lab. Professionals, ENT surgeons participating in a temporal bone course for the first time in Uganda, so that they can learn how to work with the ear and all of this, because we realized we needed to have capacity built locally in order for us to access services for our people. The lower right photo is actually a mobile ear clinic which we use that hear his voice. It's a new acquired mobile ear clinic to help us take hearing screening to the communities, because so much is happening in the communities and families don't have money to access the single hearing aid testing place in the city. But where the communities are, can we take these services? So through these partnerships, you're able to bring these services down.